Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. The theme for the day is ammunition. Ammunition to attack the enemy. The OET, the battle of OET. So you have to win and you have to defeat OET with your victory. So you need some ammunition, and these ammunition are techniques, strategies, approaches, and many other things. Listening and lesson. Listening lesson. Part B. Right. Now, very good. So what you can do is, if we have 3-4 minutes of 6 minutes. In the meantime, you write your problems related to problems, listening, part B. Focus on only this, listening, part B, problems. Write all your problems related to listening, part B. Write your problems relating to part B. I'm giving you 3 minutes. Write all your problems related to part B. Yes, you can type your answers, your problems. I can see it on my mobile. You can type your problems. This will be just 1 hour, exactly 1 hour. So we still have 3 minutes. So write your problems. So nobody has any problems in listening part B. Very good. That's wonderful. Okay. Mute everyone.
C. In this part of the test, you'll hear 2 different extracts. In each occupational English test, Part B extract, you'll hear in this part of the test, you'll hear 6 different extracts. In each Part B, in this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. Nurse briefing her colleague about a patient. Now read the question. Court setting. Extracts different. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions setting. Part B.
Contracting it by 40%.
In the health professionals talking about. Part C. In this part of the test, you'll hear 6 different extracts. Part B. You'll hear 2 different extracts. In each extract, you'll hear. In
Yes, ready.
this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse briefing her colleague about a patient. Now read the question.
Mrs. Green was admitted last night for pneumonia. She came in yesterday with a cough, fever, dizziness and chest discomfort. She's a healthy 60-year-old with a history of right knee replacement 5 years ago. She's on a regular diet and has no allergies. She's at high risk for falls due to her dizziness. We changed her IV antibiotics to oral, which she's tolerating well. Her assessment is within normal limits, except for some mild shortness of breath and wheezing. Her vital signs are stable, oxygen saturation is 98% on 1 litre, and she's been comfortable during my shift. Around 5:30, I gave her 2 paracetamol for minor pain, with good results. She has an 18 gauge in her left arm. She's got normal saline at 15 mils per hour.
Okay.
Question 26. You hear the manager of a care home for the elderly talking to the nursing staff. Now read the question.
Now, a quick word about the administration of medication. It's great to see how carefully you're all following the new guidelines, and thanks to this, error rates, which were always below average anyhow here, have dropped by 40%. The surveys we've done also throw up some interesting findings, like mistakes being more common in the morning than afternoons or evenings. We're not sure why, but there's a clear pattern. Also, we know that being disturbed for any reason while working out and preparing doses is a common reason for mistakes. So please, try and avoid distracting your colleagues while they're doing this. Finally, we must be on the lookout for drug interactions, side effects, and patient sensitivities. Fortunately, we haven't had too many problems of this nature, but the care needs of the vast majority of our residents are often quite complex.
Question 27. You hear part of a morning briefing on a hospital ward. Now read the question.
Right, so overnight admissions to the ward. Greg, could you start us off?
Sure. We have Sue Deans in bed 5. She's a 54-year-old female who was brought into the emergency department by police overnight. She has a history of poorly controlled paranoid schizophrenia. She presents with chronic persecutory and paranoid delusions and also significant thought disorder. She's to remain in high dependency unit care until the stabilisation of her symptoms. We'll be observing her every 15 minutes and monitoring the level of her distress, psychosis, and any response to interventions offered.
Okay, I'll review the clinical and detention status this afternoon. Now, what's the plan for discharge?
Social work interventions required for placement and community support options, and that's been booked for tomorrow. Also, an application for the appointment of legal guardian may be required.
Right. We'll consider that at tomorrow's ward round.
Question 28. You hear part of an antenatal consultation at a GP practice. Now read the question.
Mrs. Summer, how can I help today?
Well, I just wanted to check something.
Okay. So you're having a home birth?
Yeah, though everyone's on at me about going into hospital. I had my last child there, but I'm determined to be at home this time, to feel more relaxed as well as safe. But I wondered about an at-home epidural if I wanted it. Going without wouldn't put me off, though.
An epidural's out, I'm afraid, because we can't do it without an anaesthetist. Just pethidine or gas and air. But they're very effective painkillers.
Yeah, pethadine's good.
And you had a bad patch after giving birth last time.
Yeah, I got really depressed. I couldn't understand it. It was short-lived, though, and I'm better prepared now. It can't be prevented, but I have read up about coping strategies.
Question 29. You hear a trainee doctor telling his supervisor about a problem he had carrying out a procedure. Now read the question.
So how's today gone, Harry?
Well, I'm afraid I had a problem taking blood from Mrs. Harris. I've done that procedure numerous times now, so I wasn't particularly worried. What I hadn't anticipated was the difficulty finding a vein. I suspect her illness means she'll have had a number of cannulas inserted over the weeks she's been here, and that's led to collapsed veins.
Well, that can happen with long-term elderly patients, and it's distressing for them if the procedure isn't done quickly.
Oh, I mean, she endured it without a murmur. I'm sure I would have made a fuss in similar circumstances.
Well, I'll supervise you the next time you do it.
Question 30. You hear a doctor talking to a teenage boy who has a painful wrist. Now read the question.
Now then, I understand you fell off your skateboard some days ago and injured your wrist. Is that right?
Yes, I slipped and put my hand out to save myself. My mum says I've sprained it.
You certainly got some swelling and bruising there. But I don't think your mum's right in this case. Does your wrist hurt?
It aches, but the pain's worse when I try to grip something.
Right. Well, I suspect you've broken what's called your scaphoid bone. It's a classic injury resulting from what you describe. I can't feel any other fractures. But you'll need an X-ray to see where the two ends of the bone are. If they're not meeting up properly, you'll need an operation to sort that out. But let's see the results first.
Okay.
That is the end of Part B. Now look at Part C. Health professionals talking about aspects of their work.
Right. That's very good. We have 6 students who are regular. Okay. So we don't have any guests here. All are regular students because I did not give to the outsiders. Okay. I told you this is only for the regular students, and I mean it. Okay. Right. Now, what I'm going to do is, yeah. So here we are. Fine. So first one, yes, message. Where is it? So chat. Okay. Yeah. Question 25. Question number 25. Q25. Question 25. Okay. So there goes question number 25. Yes. So 7, 6, 5, 4, 3, 2, 1. Submit your answer because you might have written in your notebook, right? Yes. The question is in front of you. You might have written in your notebook. Please, all of you. So Ushani has submitted, Neetu has submitted. What about the others? Cecilia has submitted. Meera has submitted. Yeah, 4 students have submitted. That's good. Neetu, Meera, Cecilia, and Ushani. 4 students. That's good. Thank you very much for your participation. Right. So Desi, you can also answer the question here. Maybe you are late, so maybe you might have missed the answer. Okay, fine. Next. Okay. Next one is, so here it is. So next one, chat. Yeah, I know that because I'm the teacher. I know you're there outside. 26. Question number 26. Yeah. 7. 6, 5, 4, 3, 2, 1. Submit. Cecilia has submitted. Meera has submitted. Neetu has submitted. And Ushani. Okay, fine. So Cecilia, Meera, and Neetu have submitted. That's good. Next one is question 27. Yeah. So question number 27 is 7, 6, 5, 4, 3, 2, 1. Submit. Yeah. Meera submitted. Neetu submitted. Cecilia submitted. That's good. Next. Question number 28. 7, 6, 5, 4, 3, 2, 1, submit. Meera submitted, Ushani submitted. Very good. These are the students. Regularly attend my sessions from now onwards. Yeah. Meera, Ushani, Cecilia, Neetu, and Desi. That's very good. So question number 29. Yes. 7, 6, 5, 4, 3, 2, 1. Submit. Yes, Meera, Cecilia, Neetu, Desi, and Ushani all have submitted. Very good. And now question number 30. 7, 6, 5, 4, 3, 2, 1, and submit. Meera submitted, Cecilia submitted, Ushani submitted, Neetu submitted. Yeah. So 6 questions in all. 6 questions in all. Now the scores, we are going to find out the scores. Okay. We are going to find out the scores, how many marks you got. So I'm going to show you the answers. Then you can correct. Then afterwards we'll discuss this. I'll be explaining these questions. Yes. Yeah. Part B, Part A, 13 to 24. Part C. Yes. Part B. First answer. 25 is B. If your answer is right, tick it up. If your answer is right, tick it. Yeah, 25 is B. Then 26 is A. 26 is A. 26 is A. 27 is also A. Take your answers in your notebook. Every day we are going to do session like this, I told you. Okay, 27A. Next, 28 is C. 28 is C. 29 is A. Question number 29 is A. And question number 30 is also A. So, altogether, these are the answers. Okay, these are the answers. 180. Now, 220. Yeah, these are the answers. These are the answers. Yes, please. These are the answers. So check yourself. B, AA, C, AA, 4 A's. Maybe like that also. Chances are there. Okay, B, AA, and C, AA. Now, submit your scores. 7, 6, 5, 4, 3, 2, 1, and submit. If you have yeah, let's say 2 out of 3. Good. Neetu 6 out of 6. And Cecilia 6 out of 6. Ushani 5 out of 6. Very good. Very good. So every day we'll do some practice like this. And in the real situation, okay, the real situation, every day we'll do one practice like this online. Every day. One part B. Just it takes 15 to 20 minutes. Explanation I'll give afterwards. That's not a point. But you'll know how it is. Okay. Right. So this is the way how we are going to do one test every day. So now I'm going to ask you for your comments. Give your comments, how you felt regarding this session. My question number 1. Question 1. Okay. How was your experience? Okay. Did you like did you like the session? Did you like the session? Did you like the session? Every day you'll have such sessions. Did you like the session? Just hit the button, answer. I'll give you just 10 seconds for each question. Did you like the session? Okay. Number 1. And next, number 2. Question number 2. Come on, all of you. Write down. If you write only, no, I can help you. If you write only, I can give such sessions every day. Okay. Right. Because you are regular students. Remember that. Okay. Now I am going to invite the other students. Okay. So, come on. So, next one. Next question is number 2. Question number 2. Do you want to have listening OET dash OET means occupational English test. LB means listening part B. Listening part B. Okay. On a daily basis. Every day we'll do 6 questions. Listening part B. Full set. Full set. Okay. So full set. What is that? Full set, 6 questions, 6Q. 6Q on a daily basis. That's it. Do you want to have OET listening B? Full set, 6 questions on a daily basis. So all the regular students who have registered with the course, okay, you can attend this session on a daily basis. We are planning. Okay, I'm doing a lot of work behind. You don't know that. Okay. So, right. So, now, immediately after this one, we'll have one reading session also. Okay, same style. Okay, next, question number 3. Question number 3. Do you want this session followed by a reading session? Okay, right. Do you want this? Okay, why it is going to only one person? Don't send any personal messages, please. Because if you send personal messages, then my message is going to personal. So again, I have to type. Cecilia, don't send personal messages. No personal messages. Okay, so do you want this session followed by session to be followed by a reading session? No problem. No need to say sorry. You did not do any big mistake. Okay. So I'm inviting now many new students. Okay. Because I'm going to start an Onam batch. Right. I'm going to start Onam batch, and we are going to give Onam special option. If more students come for these sessions, not the regular session, those writing session is different, that is full pay. For reading and listening, I'm going to bring a different one. So if you want to attend, you can register. The more the number of students, the less the fees. Okay. Normal reading session is 3,000, but I'm going to, if more students are coming, I'm going to daily basis, part A, part B, part C, every day we are going to do. I've told you already, from tomorrow onwards. Right. Next one. So that is what I'm going to show you now. So this will be question number 4. Question number 4. What is that question number 4? Reading part B. I'm now talking only about part B. Afterwards, we will talk about part C. Reading part B. Full set. Reading part. Okay. Now this question should be like this. Do you want read OET? Okay. Reading part B. Full set. Daily one full set. Daily one full set. That means 6 questions. Time bound. I'll give you 2 minutes per question. That's all. 6 questions. Okay. On a daily basis. So I want this answer. Because my planning, I don't know, whatever comes to me, I'll just give like that. Right. Yes. On a daily basis. So part B is problem is solved. So every day we'll have 6 questions. And fatafat, immediately they'll go on. So, come on, respond fast. Respond fast. Because if I, bullock cart, the rider, no, the driver, he has to poke the bullocks, then only they'll run. So like that, I'm taking that sharp pointer and poking everyone. Come on, do something I'll do, because I felt today I have seen somewhere some an excellent trainer. Actually, he's not from our region. He's a native speaker. I have just noticed that he was telling many people don't actively participate. That's the problem. So I am making you to actively participate. Okay. My purpose is to reach more number of students. Not less number of students, because wisdom is to be spread far and wide. So I want you to do your best. So if that is the case, are you ready to see a trial version now? Yesterday I told you only, are you ready to participate in a trial version now? Okay, this is the 5th question. If the answer is yes, I'll give you a trial version now. Just like how we did like this, like that one we'll do. Every day we'll do. Yeah. So 3 students only are interested for participation now. What about the rest? So 4, 5. Come on. So if you participate, then I can think of part C also. The more the participation, the higher the interest. Yeah, 1, 2, 3, 4, 5, 6, 5. Yeah. So daily. 1, 2, 3, 4, 5. Right. So 5 students are interested. Okay, come on. Going ahead. Half of the students are interested. So we are moving forward. Yeah. So reading. Where is it? Reading. So open reading 1 to 36. Yes, 6 questions. First set. Yes, get ready. Hide floating meeting controls. Yeah. Okay. Two minutes for each question. Yes. 1 second.